Hello, my name is Anne-Marie Odo. I'm a student at Brandman University. I'm doing a video called the Stakeholder video, and this is about my clinical scholarly project. On this video, I will give you a brief introduction. I will talk about the theoretical and conceptual framework of my project. I will also talk about the stakeholders who are involved in this project. I will talk about the implementation of change, and I will outline some of the interventions that will be used in this plan. Let's talk about the introduction. My clinical scholarly project is based on using an evidence-based community outreach to educate, provide guidelines, and in the process, increase knowledge of a chronic disease process. In this particular population, who have high prevalence of hypertension. Recently, there has been an increase in the prevalence of sudden death of adults between the ages of 45 to 65 years in this community from cardiovascular related problems. According to testimonials from family members of the deceased, they were either recently diagnosed of hypertension, stroke, or just died from heart attack and had no medical history. The question is, in the Nigerian adult immigrant population between the ages of 45 and 65 years old, will participation in community-based blood pressure screening using the DASH diet program, pre- and post-test versus no blood pressure screening and diet program will increase knowledge and improve adherence and health outcome. This project involves taking a sample population of Africans in Dallas community with origin from West Africa who are from a medically underserved healthcare area. They have limited access to healthcare in their country of origin compared to the cohorts in They have limited access to healthcare in their country of origin compared to the cohorts of African Americans with origins from United States. This population has developed a behavior that neglects their healthcare needs and do not seek medical attention except for emergency purposes. It appears to be a major challenge as a result of poverty, poor awareness, and education about hypertension in many low socioeconomic areas. Now let's talk about the theoretical concepts. The two theories I have chosen in this project are Madeleine Leniger's Transcultural Nursing and Nola Penda's Health Promotion and Illness Prevention. These theories will be incorporated into this CSP as they deal with cultural issues and disease prevention. Next, let's talk about the stakeholders. The stakeholders are encouraged to embrace changes and add value, and should be motivated to change from what they are accustomed to. The cost-benefit analysis for any change should be communicated to stakeholders and be sufficient to sustain the application to practice. Stakeholders' resistance, influence, and organizational culture to change have been noted as some of the major barriers to implementing evidence-based practice. The stakeholders in this CSP are those that are involved and essential in the implementation and success of the program. This includes the following people: the pastor of the church, who will grant permission for the location of the project, the medical director, who will consult with the participants during pre-screening, implementation, and post-screening, and prescription manager. This includes the following people: the pastor, who will grant permission for the location of the project, the medical doctor, who will consult with the participants during pre-screening, implementation, and post-screening, also prescription management, the nurse practitioners, nurses, and local vocational nurse. No. the nurse practitioner, nurses and licensed vocational nurses, and other volunteers responsible for data collection, follow-up, teaching. Also, dietitians who advise and monitor the DASH diet plan for the participants. Let's talk about the implementation now. Blood pressure screening on Sundays after service with all the stakeholders available. Using the DASH diet plan provided by the Centers for Disease Control and Prevention Services, setting up a booth at the local church due to the high number of African Americans in this region will be the first step. This will be accompanied by educational materials which provide all the relevant information regarding the factors that increase risks for suffering from cardiovascular diseases to the needed changes that have to be made. The educational materials will also contain information on the available treatment for persons who are suffering from health conditions and the contacts of the nearest healthcare clinics that provide the mentioned services. The educational materials, in order to fit in with the reading habits of the people in the modern society, will have a lot of diagrams and pictures which make them attractive and easy to understand. In conclusion, the goal as it is provided by the Healthy People 2020 is to improve cardiovascular health and quality of life by preventing, detecting, and treatment of risk that enhance heart disease and stroke. Early detection makes it easy for medical practitioners to prevent deaths related to cardiovascular health-related problems. The objective of the health promotion and disease control will be to decrease deaths which are caused by stroke, heart disease, hypertension in the society, which can be linked to early deaths among these African Americans. Thank you.